Earlier, if somebody was advised to undergo a cervical spine surgery, it almost always meant that a fusion surgery would be required. With recent advancements, we've now developed something called as a total disc replacement in the cervical spine. When you do undergo a fusion surgery in the cervical spine, it usually means you end up losing part of the natural movements of your neck. That means forward bending, rotations, and side-to-side movements. However, with total disc replacement, you end up preserving your natural neck motion at the operated levels. Hi, I'm Dr. Aditya Raj, an orthopedic spine surgeon working at Synapse Spine. At Synapse Spine, we use modern technology in terms of cervical disc replacement to treat your neck issues. With this kind of technology, we try to preserve the natural neck motion and provide you with optimal and precise outcomes. You might remember this tweet from Elon Musk trying to emphasize about the importance of cervical disc replacements when undergoing cervical spine fusion. There are primarily two types of cervical disc replacements. One that is a hinge type, and the second that allows movement in both translation and rotational planes. Both of them have their own advantages and disadvantages. Which patient would require which kind of cervical disc replacement is analyzed based on patient presentation, their MRI picture, the extent of compression, and the level of mobility at the segments that require fusion. If you have been advised a cervical spine surgery or precisely a fusion surgery, make sure you consult expert surgeons regarding the possibility of a cervical disc replacement. Not all patients are ideal candidates to undergo a cervical disc replacement. All patients are judged based on their presentation, their symptoms, and the level of arthritis in the neck joints to see if they are ideal candidates to undergo this kind of surgery. Meet experts at Synapse Spine and see if you are an ideal candidate to undergo this procedure.